Good evening, everyone. Thank you for joining us for our emergency care webinar. Indian Road Safety Campaign has been working towards the vision of zero road accidents in India. As a part of Road Safety Initiative, today on the World Trauma Day, we have joined hands with Johnson & Johnson for presenting the emergency care webinar. My name is Astha Pandey. I am Assistant Program Manager with IRSC and your moderator for this session. I'd like to introduce our esteemed speakers before we start the session. Today we have with us Dr. Rajiv Raj Choudhry, Chairman and Chief Orthopedic Surgeon, Asutosh Hospital, Surat. His experience has provided him a solid grounding in the general principles and practice of broad spectrum of elective orthopedics and trauma. In addition, his specialization has been in the fields of hip surgery, knee surgery, and poliomyelitis. Dr. L. Tomar, Director and Unit Head Orthopedics and Joint Replacement Surgery from Max Superior Specialty Hospital, Delhi. He has more than 25 years of experience and is an eminent personality in the fields of invasive and non-invasive orthopedic procedures. His expertise lies in providing complete patient care while performing all involved surgical and non-surgical procedures. A warm welcome to you, sir. Dr. Ranjan Kamiliya, Senior Consultant Orthopedic Surgeon from Apollo Gleneagles Hospital, Kolkata. Dr. Kamiliya has a vast experience of 25 years in the field of orthopedic surgery. His specialty lies in orthopedic surgery, arthroscopy, joint replacement surgery, knee surgery, and trauma surgery. Greetings to you, sir, and a very warm welcome. Before starting the session, I request the participants to write their questions in the chat box. We will be having a small Q&A at the end of the webinar, where the speakers will be answering your questions. And there will be an attendance form in the chat box. Please fill it before leaving the webinar. Now I request Dr. Rajiv Raj Choudhry to please enlighten us a little bit about the World Trauma Day. What is trauma and what are the causes and impact of trauma? Additionally, if you can take us through the history of emergence of trauma care in India. So over to you now.
Thank you very much, Ashtar. Am I audible? Am I audible?
Yes, sir.
Yeah. Thanks once again to Johnson & Johnson and Astha and for organizing this very, very illuminating and a very apt webinar. Today is the 17th of October, which is commemorated as a World Trauma Day. This was a day in 2011 in New Delhi when this day was, they started remembering this day to emphasize the need for averting death and disabilities caused by accidents, trauma, and because statistics had revealed at that time that there is one death in India on the road every 1.9 minutes. And about 22% to 23% of deaths of trauma are because of vehicular accidents. Trauma actually is any physical, or even today it's extended to emotional injury that takes place to the body. So it's not just physical, but various causes that we see in daily practice would include road vehicular accidents, children playing and falling down, factory accidents, fires, burns, etc. So although when we talk of trauma, everyone thinks only of the road traffic accident, but actually it encompasses many, many more causes than just road traffic accidents. If we see that more than 1 million people die of trauma every year in the world, and more than 20 million, 20 times that number, they are hospitalized due to accidents. Now, whenever there is an accident, this is a spectrum. It could be from a very minor injury to life-threatening and can also lead to death. So this is a very, very wide spectrum. And the important thing to remember for everyone is that the first hour is the golden hour. And this is the time when if we can reach the person or the patient and we try to resuscitate, many a times it happens that what looks to be minor at in the initial period becomes very critical and life-threatening at the end of an hour. So I think probably it is a very good initiative that has taken place where trauma is taken so seriously. Now, in order to get everything in the right place, we have to have the first aid that is on the road before the ambulance or before any medical help comes. There has to be a first aid that is given initially, and after that we should have people who have proper training that attend to the person, and this patient is then carried from the roadside to a hospital setup where further treatment can be carried out. It reminds me that in the year 2007, there was an excellent paper by Dr. Cole, who wrote about the Indian ambulance services and said that although we have more than 1 lakh accident-related deaths, we have 98% of ambulance runs that are carrying dead bodies. More than 90% of the ambulances do not have adequate oxygen. 95% of these ambulances do not have well-trained people who do not know what to do. And despite all, in addition to this, over 30% of the ambulances were misused. People, ladies would be going shopping in an ambulance or whatever. So this was 2007. I think we have come a very, very long way from then to today. It has become a very big difference beginning in 2010. Actually, it started in 1996, but in 2005, the emergency number of 108 was allocated for emergency services. Now, this emergency services would include heart problems, neurological problems, vehicular accidents. But as today is a World Trauma Day, I would be only talking about the trauma rather than other emergencies. So if we see, this initiative was started by a very few very enthusiastic people on their personal front. And I think one must give the credit to Rajlingam of Satyam Computers, who made this as a corporate responsibility of the Satyam Computers and started this emergency service, which was a very, very big step and has made a very big difference today. So now we can say that we have got emergency departments in many hospitals that go for that go for evidence-based medicine and protocols to resuscitate these patients. And we have the galaxy of speakers behind me who will be enumerating on all those things. With this, I think probably I would hand over to my next speaker, and they could start, and then I would follow it at the end of the webinar.
We just need to know what are the causes and impact these trauma have.
Yeah, the causes mainly, if you see, are if we are not looking after the causes are, road traffic accidents usually would occur because we are not following road traffic rules, the safety measures that should be taken, wearing helmets or seat belts. And one of the major things is these days the mobile use on the vehicles is a very high cause of people not being able to concentrate. Many people have the habit of driving very long hours, and because a person is tired, he loses concentration and leads to a road traffic accident. So as a matter of fact, there would be a lot of other causes as well that would cause road traffic accidents. But what I would feel is that if we are looking after, if we are taking, teaching the children in schools for road safety, that is where we should hit. And we find that in many cities, including my city of Surat, the traffic police does not bother if there are 4 people sitting on a vehicle, whether they are with a helmet or not. I think on one side, educating people about road traffic and the problems that are associated with accidents, because once an accident takes place, it is a very, very major psychological, financial, social impact to the whole family. If say, and the biggest problem is that about 80% of these people are between, of the deaths that take place are between the age of 20 and 45. And that is the prime time when the people are earning, and they're the sole bread earners for the family. And if such a person dies, or if he's left with a permanent disability, the whole family has to suffer lifelong. The other major thing is that while in the high income countries, only 10 to 15% of the vehicles are two-wheelers, the rest, about 80% of the vehicles are four-wheelers. That is opposed to India, where about 80% of the vehicles are two-wheelers and only 10% of the 15% of the vehicles are four-wheelers. So, I mean, with the two-wheelers being an unstable vehicle, the chances of injuries are very, very high. The other interesting statistic is that about 80% of road deaths occur from buses, trucks, and cars, which form only 20% of the motorized vehicle on the road, as opposed to most other countries where the four-wheelers and the bigger vehicles like trucks and buses are in large numbers. So I think probably I have enumerated what are the usual causes of these accidents. Would that answer your question, Asta?
Yes, sir. Thank you so much. So that was very informative. Thank you. So Dr. L. Tomar, I request you now to explain our audience about the important laws and policies of trauma care, and what are the improvements happened on those policies and law, and are there any current challenges we are facing regarding those? Sir, is off. Yes, sir.
Okay. Thank you very much, Asta, for giving me this opportunity, and thanks Johnson Johnson and the organization which has organized this webinar. And my topic for this talk today is important laws and policies for trauma care, scope of improvement, and the current challenges we are facing with the modern trauma care policies. So to begin with, I would like to say that road traffic accidents are among the top 10 global killers, and roughly 2/3 of RTA deaths are among the age group of 15 to 44 years, which is a productive age. This waste of precious lives is largely preventable by early and good emergency care. However, in India, there is no specific law laid down by the government to provide emergency medical care, and is often interpreted as a right guaranteed under Article 21 of Constitution of India, which grants right to life to all Indians. To secure protection of one's life has been declared to be one of the foremost obligations of the state, both under Article 21 and Article 47 of Constitution of India. In 1986, Consumer Protection Act was modified to include doctors in this legislation. While it is the right of the doctor to give treatment to the patient whom he wants to, this is the choice of the doctor, but it is his moral duty to provide emergency medical care to the person who is in urgent need of it. So the doctor can't say no to a patient in emergency. though incorporating healthcare services under the scope of Consumer Protection Act does not serve the purpose, because there are times when the patient has no guardian to look after and requires emergency medical care. This results in a denial of emergency medical care by the doctors because there are no attendants and no consent. 201st Law Commission report on emergency medical care to the victims of accidents, prepared in 2006, is the only healthcare report which talks about providing medical emergency aid. This report emphasizes that emergency medical services has to be legislated so that the patient can enforce their rights. It recommended that the parliament should legislate this issue and make it an absolute duty of the healthcare institution, whether public or private, to provide emergency medical care. There is a Good Samaritan law, so we must know about this. It, uh, it says that a fair number of people are hesitant to help injured victims. A Good Samaritan is one who comes forward to help an injured person without expecting anything in return. And Good Samaritan law protects Good Samaritans from harassment on the actions taken by them to save the lives of the road accident victims. In spite of this law, the people are hesitant in coming forwards and help the accident victims. In 2007, the state of the Gujarat established Gujarat Emergency Medical Services Authority, that is GEMSA. This regulates a state-wide system of emergency medical care and further brings NGOs and other private agencies to work together for providing emergency medical services. There are certain current challenges in providing best medical care, and those are that pre-hospital care is neglected issue in India. Golden hour is the first hour in which emergency medical care is necessary, and most victims die if no such care is provided soon or within time. Transportation of the patient from the accident site of the to the hospital is very critical, and careless handling of the accident victim can lead to a second accident and further worsen the condition of the accident victim. There are no formal pre-hospital care, uh, as was shown by a South Indian study, that it was not offered in 85% of the trauma patients. Triage is a concept that is instrumental to good emergency care, but is rarely practiced in our country, in most of the places. There are no guidelines or regulation on the issue of pre-hospital care. And the another very important point is that there is reluctance in handling medical emergencies, especially in medico-legal cases. Medical emergencies, which are medico-legal cases, doctors tend to evade. Why? Because of the inconvenience associated with subsequent lengthy and tiresome legal proceedings. However, the Supreme Court of India has clearly stated that the first obligation of a doctor is to save the life, and documentation and paperwork could be performed later on. Another factor for showing reluctance to serious emergency cases is to avoid the mortality in one's own hospital, and in case of death of their patient, the relatives often resort to manhandling of the doctor, paramedical staff, damaging the hospital property. The action of police and local government administration, like immediate arrest of a doctor under mob or public pressure, is another important issue. These kind of incidences are increasing day by day, and thus are responsible for doctors not handling the emergency cases, particularly the medical legal cases. This leads to further delay in timely emergency services. And moreover, there is no clear-cut demarcation of duties and responsibilities in emergency department in government hospitals, leading to delay and confusion. However, there are certain areas of improvement, and there is a lot of scope for improvement. Road traffic injuries should be declared as notifiable public health issue by the union government. There should be road traffic injury registry, which is the need of the hour, and to be started urgently to record all minor and major injuries on road to study the prevalence. There should be a provision for training on road safety from KG to PG levels with the new slogan, road safety of the people, by the people, and for the people. There should be research units on the road safety, and they should be established. Establishing emergency services network is a must and must be done. Emergency vehicle services provided by some of the agencies in some states like Ahmedabad, Delhi, Pune, Haryana, and Uttarakhand should be evaluated and implemented across the country. They are working very well, so they should be implemented across the country. There should be a common telephone number across the country for EMS. Common number 108 is very popular in Uttarakhand and working nicely. The staff on these EMS vehicles should be adequately trained, and awareness regarding emergency medical services may be created by media by publishing success stories of EMS vehicles in saving precious human life. The another area for scope is there can be improvement of healthcare teaching and learning. There should be an integrated teaching on injury science, highlighting role of early intervention, triage, and establish protocols for emergency care. There should be systematic planning and implementation over the next decades for first responders training. Ambulance, fire and police personnel should be trained in pre-hospital care and should be provided with well-equipped ambulance, including well-oiled communication and referral system. Another important point is there should be concept of bystander training for pre-hospital care and should be introduced from KG of education to PG level in all the courses and curriculum for all the citizens. Thank you very much.
Thank you, sir. Thank you, sir. That was very insightful. Now I will ask Dr. Ranjan Kamiliya to explain us the emergency care tips we all can follow to be a good Samaritan. Sir, I will be, you can share your screen here. You are the, you can start sharing your screen. It's there.
Okay, I'll do that.
Okay. Yes,
now, first of all, good afternoon to everybody. And my sincere thanks to Johnson & Johnson and the Indian Road Safety Campaign for organizing such a wonderful session here. Now, today is the World Trauma Day, and which is being observed just to remind us the number of lives which is being lost each and every day due to road trauma, road traffic accident throughout the world. And Dr. Rajiv Raj Choudhry has already given you the figure that what are the incidences of road traffic accident on Indian roads. And this figure was actually projected in 2016 that it will reach probably more than one death every minute by this year. Now, if you want to help a trauma victim, I think you should understand a few basic facts and also know what is the importance of a quick response. Now, in any road traffic accident, the first peak of death occurs within minutes. That may be due to severe head injury, brain streaming injury, injuring the respiratory center, a high spinal cord injury, or injury to heart, aorta, or massive blood loss. But these are usually non-salvageable. But what is there salvageable? This is the second peak of death, which occurs in the next hour. That is the first hour, also called the golden hour. The causes are mainly intracranial bleeding inside the head, the chest injury, abdominal bleeding, pelvic bleeding, or multiple limb injury. Now, the golden hour is a theory stating that the best chance of survival occurs when a seriously injured patient has emergency management within 1 hour of this injury. And then comes the third peak of death, which occurs after several days or weeks, maybe due to infection or multiple organ failure. But again, this is also influenced by early management of the trauma patient. So if we can provide an early good trauma care, then we can save a lot of lives. So if you see the life salvage situation, 50% deaths due to trauma occur before the patient reaches the hospital, 30% occur within 4 hours of reaching the hospital, and 20% occur within next 3 weeks. So if preventive measures are taken, 70% of deaths can be actually prevented. That's a massive figure. So what can you do? As a good Samaritan, you can administer first aid care. But what is first aid? It is the initial assistance given to someone who is injured or unwell until proper medical assistance arrives. But for that, you actually have to learn how to administer first aid the right way. Mind it the right way. Okay. Otherwise, you can end up putting the victim in even more danger if you don't know how to properly administer first aid. So the priorities of first aid is to preserve life, alleviate suffering, prevent the condition from worsening, and ultimately promote recovery. The first and foremost thing of first aid is the primary survey. So you have to look for anything which is life-threatening. That is the first and foremost thing. So you remember the numeric Dr. ABC. D for danger, R for response, A for airway, B for breathing, C for cardiopulmonary resuscitation or circulation. But in this, you may not be able to perform everything. I'll give you as just basic facts or basic things which, as a good Samaritan, you can do as a bystander. So the first thing is D, danger. First of all, you have to ensure your own safety because you are the person who is going to help this trauma victim. So you are very important. You have to make sure that all traffic is stopped. Oncoming traffic may actually pose additional danger. And note, if there is any fuel spillage or potential fire risk, if you find that, try to turn off the ignition as soon as possible, and that you can avoid a fire hazard. Next comes the response. First of all, you quickly assess occupants of all vehicles involved in the accident and look for anyone who is having life-threatening injuries. This is very important because you have to try it. You have to see who is having life-threatening injuries and take care of him first. So your initial priority is to check anyone who is quiet and not moving, because the people who are actually screaming, crying, and making noise are actually breathing, and they can be looked up later. So this is a very important point to note. Next, how we grade this response is by this called AVPU. A is the person is alert, or say V is the person actually responds to voice prompts. P is the person responds to painful stimulus or shaking to make sure that the person is responsive. And then U is the unresponsive. So if the person is unresponsive and actually you are on your own at this point, then you have to call for help. So call the ambulance. And we have in India, there is a national emergency number 112, which gives police, fire, ambulance. So you can just dial it from your mobile itself. Even if you do not have balance, you can reach this and they will reach back to you. Next is to check the airway. If the person is unresponsive, ensure he is in a position leaning forward or to one side, which will keep the airway open. Now, if a person is lying flat, the tongue actually falls back and blocks the airway. So just by doing simple head tilt and chin lift, you will clear the airway, and this can actually save a person's life. Next comes breathing. Check for breathing for about 10 seconds. Look at the chest rise. Go close to the person who is fallen down. Look at the chest rising and falling. Listen and feel for breath on your cheek itself. And if the person is breathing, then you look for other injuries. Next comes the cardiopulmonary resuscitation. But for this, again, you have to be trained. So do not just jump into doing a cardiopulmonary resuscitation just because you heard about it. You need to be trained. So if the person is not breathing, you will need to resuscitate this person. So if you are alone and not called for help, call now and ask the ambulance person as to how best way to resuscitate. Because you remember, it's not easy to resuscitate when the person is actually in the car. It's not the patient is lying flat on the floor. The patient is in the car and it may be very difficult to resuscitate the person. So it is advisable to attend a first aid training session to learn the techniques of CPR. But I'll give you just a brief in a video later on, just to show you how we do CPR. There are some important checkpoints. Only remove an unconscious person from a vehicle if there is immediate danger of fire, flood, or explosion. Because it may be very difficult to remove an unconscious person from a vehicle. If you are just on your own, you have to have help to actually remove this person. And then you may have major danger of worsening their injuries or injuring yourself. You have to be careful how and when you move the casualty. Again, this is a very important point to remember. While moving the victim, you support his neck to avoid twisting, as there may be a spinal cord injury, a cervical spine injury. So that may actually worsen the injury. Only remove a motorcyclist helmet if he is unconscious and breathing cannot be assessed or the air is in the danger. Now, once you have done this, you can place the patient in a recovery position, which is a way of placing the person in a more safe and secure position. And if the casualty is hit by a car and lying on his back, carefully roll onto the recovery position to keep the spine in line. And also you have to take help of others, because if the person, again, as I told you before, has a spinal cord injury, then you'll worsen the injury. I'll not go into the details because the next video actually explains how you should do that. Just a note about the bleeding wound. If you see a person with bleeding wound, your first course of action again should be call for an ambulance, apply direct pressure to the wound to stop bleeding rather than applying a tourniquet. If you do not have a sterile gauze, you can use a clean handkerchief to apply direct pressure on the bleeding wound. Once the bleeding stops, wrap the wound securely with gauze. If the bleeding doesn't stop, even after applying direct pressure, you can use a tourniquet, but that has to be very temporary. So all this is actually doing the primary survey, and during the primary survey, one must remember that the life-threatening conditions are identified and as well as managed simultaneously. So it's not that you are first finding out all the life-threatening injuries and then only you are going to take care. No. So I'll just go to the a basic first aid training session, which is I've taken from the YouTube by Michelle Dorset. And this was done in UK. It's recent 22 guideline. Just go through it. It's a very short video. I think it will be helpful for everybody. I think that's good enough for this. We'll go to the next one. This is a basic resuscitation, a cardiopulmonary resuscitation. Just a short one. I'll not go through the whole video. I think that's good enough. I just a good explanation of how you do a CPR. So I'll just go summarize the whole what we have done. So a person has the best chance of survival if he receives emergency care in the golden hour. As a good Samaritan, you can administer the first aid, but first you have to learn how to administer the first aid the right way. And look for everything, anything which is life-threatening, and remember the mnemonic Dr. ABC. And you can help save the life of the trauma victim. Thank you very much.
Thank you. These tips would be very helpful at the time of the need. And it's a very great video. So I think now we will be moving towards the Q&A session.
Yeah.
I have quite a few questions regarding from different people. So my first question would be for Dr. Rajiv. Someone asked, what is the difference in normal hospitals and trauma care centers, and what is usually expected from trauma care teams?
See, the trauma care centers would include in 2020 an intensivist, an orthopedic surgeon, a physician, because we are talking of emergency services that go with the trauma services as well, in addition to a very organized approach to the patient, as opposed to other emergencies where the hospitals where whoever is in emergency, there's just a patient comes, a junior doctor attends, after 2 hours someone else comes. So it's that rule of getting the golden hour treatment, and protocols are used in trauma centers as opposed to the other hospitals, protocols are not instituted.
Okay, sir. Okay. Sir, the next question is for Tomar, sir. Sir, can you explain which law is critical at the time to be known by all citizens to reduce road trauma incidents?
There is no such law to reduce road trauma accident. This is only the behavior of the public, the behavior of the kind of traffic rules we are obeying, and the training of the public, like the bystanders could be good Samaritans. They should be able to come forward. They should be properly trained, so that the previous speakers told, explained about the how we can save the life in the first critical hours. Then how the patient should be transported to the hospital, so there is no further damage. And whenever the patient is reaching to the hospital, an immediate care should be given to the patient. Only that way we can save the lives of the accident victims.
Can I say a few things here? I think there is a big role for the administration. A strict administration can actually help a big way in reducing the number of accidents. As I can see here in Calcutta itself, there have been, I know previously our traffic condition used to be quite bad, and people in all over India used to talk about how congested the Calcutta city roads are. But if you see now, there are, I think, in number of traffic cameras. So there is, speeding has really decreased by way ahead from any other states which I have seen, or the other cities. Okay. And that has actually reduced the number of accidents also. If the police are quite strict and giving cases, nowadays, I think the Supreme Court has passed a rule that if a person is overspeeding or speaking on mobile while actually driving, their license can be actually, not actually, the police is supposed to suspend their license for 3 months. That is the new Supreme Court ruling. Okay. If the police is strict, it is definitely going to reduce the number of road traffic accidents day by day.
Yes, sir. Rajiv, sir, yes.
I would entirely agree with Dr. Ranjan. They used to say that anyone who can drive in Calcutta can drive anywhere in the world because the traffic was so bad.
Yeah.
It has improved. But the problem is with the Supreme Court ruling, the police make a killing for you have to do a wallet biopsy if you're caught, because instead of giving your license for 3 months or whatever, you have to dish out a big sum of money. So it's leading to, I totally agree. If you ask me, the question was very nice. How any law? There's no law. But there are certain do's and don'ts which I would enumerate. Number one, follow road rules very carefully, safety rules. Pay close attention to warning signs and traffic signals while driving. Always wear a helmet and a seatbelt when driving. Avoid distractions of mobile phones and music while you're driving. And keep your children away from electrical switches, wires, sharp objects, or medications. And there would be certain don'ts also that I would like to add. One should not drive when you're feeling tired, so don't do that. Don't take risks when driving, even in case you are in a hurry. You should not operate on hazardous machinery, so that's factory accidents. In case of head or spinal injuries, do not move the patient from the site of injury without being very careful or taking professional help. Take professional help for this, and please do not give fluids to any unconscious or semi-conscious patient. This is a very common practice in India. Anyone who is not responding, pani do, it starts. You should also ensure that there is a first aid kit in at least the building that you are living in or wherever You get a chance to advise, ask them to have a first aid kit at home, in the building, and ensure that all your stairs, windows, balconies, roofs, they have parapets so that people do not fall off inadvertently. One should make it a point to learn the basic support techniques, especially to help the injured. I think that would summarize most things to answer that question. How can we prevent trauma?
Yeah, I'll come again here. Just a point to make. Now, here, what's happening in Calcutta? You know the traffic cameras which are there. Once the person is speeding, you directly get an SMS. It's an automatic response which comes directly to your SMS or your mobile phone that you have actually exceeded the speed limit, and that fine has been raised to you. So you have to go and pay. So nobody is actually coming here counteracting you. So that is a good itself, because it shows you that you have overspeeded, and there is a fine for penalty for that. So that's how it is conducted.
Can I add something?
Yes, sir. Yes, sir.
Despite all the rules and strict application, and the penalties are very heavy in Delhi, the traffic is well regulated. There are a lot of cameras, but I don't see any numbers reducing of the trauma cases. The number of accidents and the trauma cases have increased in the last years. However, there are strict rules. The penalties are very high. There are a lot of cameras. So I would say this is the behavior of the public which have to be disciplined in obeying the traffic rules, and not the administration only has to be strict.
Very true, Dr. Tomar. You cannot just ask the administration to be strict. It has to come from within. Yes. That yes, you have to change your habits. Yes, very true.
This reminds me of the campaign for stopping smoking. It used to be fashionable in the 70s and 80s to smoke, and it was in the school that the curriculum included the problems and the disadvantages and the disease processes associated with smoking, to the extent that the children would be telling their parents. It has taken 20 years, but today there would be a lot of people who would not go ahead with a marriage proposal if the spouse is a smoker. So I totally agree. It will take a generation to get what Dr. Tomar has said, that unless it comes in from the culture, and that takes time.
Yeah. Very true, very true.
So, yes, sir.
There is another question there. Regarding mouth-to-mouth breathing. You know.
Yes, someone asked.
That's a very important point. I don't think that there is an alternative to it, other than just putting a clean, say, a handkerchief or something to protect yourself, and then give the mouth-to-mouth breathing resuscitation. I don't know whether Dr. Tomar or Dr. Rajiv Raj Choudhry knows anything of any alternative to it. Do you know that, anything?
In the present day scenario, I think nobody would like to go for this type of breathing.
That's what is happening.
Pandemic time, I think that is not advisable.
Yeah, I'm not talking about the pandemic time. That is out of question, yes. But even otherwise, when the pandemic was not there, even then, by culture, I think it is not well accepted that you go for mouth-to-mouth breathing. So that's how the patients get neglected also.
So, sir, this would lead to our next question. I think that would be the last question, because we don't have that much time. So it's the question for you, Ranjan, sir. So what is the one basic life-saving technique everyone should know and can be taught in schools as well, to if there is any emergency as such needed?
If you see in the first aid itself, I had given that Dr. ABC airway. The first and foremost thing is check for the airway. And many of the times, just by clearing the airway, you can save a person's life. And that is just by tilting the head and lifting the chain. Because when you are lying down, say unconscious person is lying flat, the tongue actually falls back and obstructs the respiratory passage. So just by doing a simple maneuver of tilting the head and just lifting the chin forward, that will clear the airway. So that is the first and foremost thing. And then next to obviously the breathing, look for the breathing and then go ahead with your speed. So first and foremost, Yeah, or one thing if you have to say, it is the checking the airway.
Okay, okay, sir. Sir, I think we can ask one more question. So the question would be for Ranjan sir. So someone asked, do you think instead of 102, 108, 112, and 1033, we should have one single three-digit number for the entire country for synchronization of all ambulance under it? It would be helpful for the trauma care centers as well, and it would save time.
Yeah, absolutely. If you see, I had actually put in there the emergency number 112. That's not only for, say, it's not for single for ambulance or single for police or fire. It's a one number, and they actually direct to whichever service is necessary. So that's a good, and it has to be implemented everywhere in all states. And that's how you can actually tackle all these emergencies
Okay,
in a
okay.
much faster way.
So, okay, sir. So I think we would be ending our Q&A right now. And before ending the webinar, I think we are ending the webinar. Do you have any closing thoughts regarding the session we had today? I would start with Rajiv sir. Sir, do you have any closing thoughts?
I think we've had a very good discussion,
Yes, sir.
but it is very important that this discussion goes into execution. So it would be time that people who are involved in the care of trauma, they are involved in a very active way. And one of the greatest problems is the inadequacy of trained staff, especially in the ambulances, etc. Because there are small schools all over the country. They create their own syllabus and they certify that this person is a trained medical technician, and virtually they do not know it. So there's no homogeneity. So if you ask me, probably we have a long way to go. We have come a long way. I think India is amongst, I mean, if we consider the amount of geographical vastness that we have now included going into the rural areas from just the urban emergency care, we are doing extremely well. But I think we have a very, very long way to go. And it is time that we join hands in a very active manner. This should not be a one-day World Trauma Day, 17th October, and on the 18th, everyone forgets the whole trauma business. So I think probably we must take it very seriously, very, very seriously. Thank you.
Thank you, sir. So, Tomar sir, do you have any final thoughts?
Oh, yeah.
Yes, sir.
I think we have a great shortage of emergency doctors in our country. In the hospital also, we will find very few emergency trained persons. However, in corporate hospital like ours, we have a good team of emergency specialized, super specialized emergency doctors team. So there should be a special training for the emergency doctors. In the graduation stage also, there is no specific training course which would be the emergency care. And my suggestion would be that this emergency treatment and the good behavior should be started, and teaching should be started from the school level. All the students should be trained to treat like the doctor, the previous speakers told about the CPR and the other emergency management. They should know, they should be trained, and they should be trained. They should be told to obey the traffic rules so that the accidents could be avoided. And there should be, on the government part, there should be good ambulance services, and patients should be entertained well, not being scared of the legal formalities, and patients should be treated on the priority basis. I think that's the
Thank you,
message
sir.
from my side.
Thank you. Ranjan sir, do you have any final thoughts?
Yeah, I fully agree with Dr. Rajiv Raj Choudhry and Dr. Tomar also. But there is a long way we have to go to organize our whole trauma care. It should start from our, the children should be definitely taught in the basics of the resuscitation, the basic first aid training should be there. Okay, it should be included in the curriculum. And then I think we have to give incentives to the the paramedics who are supporting, so that you can actually make a lot of more paramedics to join the emergency services and ambulance care. And there also has to be from the governmental side also, the care has to be there. Provide enough ambulances so that these emergency patients can be shifted to the hospital, the nearby hospital, as soon as possible, along with the recent laws which have been there. So I think we are going forward, but there is still a long way to go. Thank you.
Thank you so much, sir. Thank you. So we are ending with our session. I would just like to thank everyone for joining this session. I'm sure our audience has gathered key insights from this webinar and what role it plays in road safety. I would like to thank our speakers once again for their valuable time. And we are grateful and we hope you enjoyed the session as much as we did while listening to your knowledge and thoughts. Thank you so much, everyone, for joining. We would be ending the session now. Thank you.
Thank you. Thank you very much.
Thank you for joining. Thank you.
Bye.
Thank you. Thank you, sir.
Thank you very much, Asutosh. Thanks a lot.
Thank